And before you head out on a long haul flight, you may want to pay attention to this. Sitting on those long flights could have some very serious health risks. And here to explain is Dr. Jake Hemingway, a vascular surgeon with UW Medicine. Dr. Hemingway, thanks for being with us.
Yeah, of course. My pleasure.
So let's talk about blood clots. What is considered a long haul flight? In other words, at what threshold should we be mindful?
Yeah, really any long flight that's looking at either a transatlantic, transpacific, or transcontinental. So you start thinking about your blood clot risk going up really once you get over that 3 to 4 hour thresh mark.
Okay, and who exactly is at risk?
Well, really anyone. There are certain factors that are going to raise your risk of having a blood clot. Oftentimes, though, patients don't know that they have thicker blood or other things that will raise their risk of getting one of these blood clots. And so really, it's good to keep in mind what the signs and symptoms are and some of the ways in which you can reduce your risk that is really easy for everyone to do.
Okay, so what are some of those signs and symptoms?
Yeah, the biggest things are going to be leg swelling or leg pain, since these often impact the deep veins of the legs. And so if you notice after a flight, for example, that you're having persistent leg swelling, persistent leg pain, those are things that should make you think, especially if it's way different than normal, maybe I should go to a doctor and get checked out.
I have a follow-up to that in a second, but I also want to ask you for your tips for preventing blood clots.
Yeah, absolutely. There are a couple of very easy things to do. First is wear compression stockings if you can. There's a lot of companies that sell compression stockings, and they're very easy to find online or in stores. Second is to stay well hydrated, drink a lot of water. And the third is to walk or to perform basic calf exercises while you're sitting in your seat. Basically flexing your ankle up and down like you're pressing on the gas pedal is a great way to do that, and try and do that every hour.
Okay. So doctor, I have a story for you. I recently traveled like halfway around the world on some really long flights, and I had compression socks with me. My mother gave them to me. I didn't want to use them. I was fine on a few flights, but then suddenly on one flight, my ankle started to swell. I mean, I'm talking, they look like balloons. And it scared me. So I made sure to wear those socks on the next really long flight home, about 15 hours. Because it scared me enough. But what happened there, and is that a warning sign?
You know, it certainly could be, but also just having your legs down below you for a long period of time like that is not something we do on a day-to-day basis without getting up and walking around. So swelling in and of itself isn't always a blood clot. It could just be related to fluid pooling in the legs just in general. But this is why compression stockings are great, because they make your shoes fit better once you get off the plane, but also just make your legs feel better. I wear them, for example, during surgery when I'm up on my feet for a long period of time.
Oh, really? Wow. Okay. Well, hey, Dr. Hemingway, thanks so much for your time today and for speaking with us, giving us those tips, especially as we are in the midst of spring break and summer travel soon.
Yeah, absolutely. Safe travels to everyone out there.
Thank you.